Hi everyone, this is Olivia and welcome to my third patient presentation. So I saw a 72-year-old male on January 26th. Nutrition was triggered because he was a 2 score, so he scored for impaired intake and then for weight change. So he was recently diagnosed with chronic myelomonocytic leukemia, which is a rare blood cancer. And he developed symptomatic splenomegaly and is now status post a splenectomy that occurred on January 17th at St. Margaret. He's now been admitted to Passivant with poor PO intake, weakness, and failure to thrive. And then the splenectomy pathology revealed that he has systemic macrocytosis. And then the day I saw him, he had an EGD performed, and they found that he has grade D reflux esophagitis. He had a nodule that was in his stomach biopsied, and then his duodenum was normal. As for his medical and surgical histories, he has the splenomegaly, melanoma, and then the chronic myelomonocytic leukemia. He also has hypertension, hyperlipidemia, arthritis, psoriasis, and cellulitis. And then surgical history, he's had a tonsillectomy, thumb surgery, left hip replacement, left foot abscess removal, melanoma removal, right neck cyst removal, right shoulder scope, a bilateral rotator cuff repair, and then this recent splenectomy. He denies any tobacco, alcohol, or drug use. For nutrition history, he's had weight change. He is on a few different medications, so he's on famotidine, finasteride, pantoprazole, Flomax, acetaminophen, Tums, hydromorphone, melatonin, Zofran, magnesium sulfate, potassium chloride, and then he is receiving sodium chloride through an IV and then D5. He has no known allergies. He's currently on a clear liquid diet following his EGD, but his PO intake has been poor. For his anthropometrics, he's 189 centimeters. His admission weight was 92 kilograms. His usual weight was 112.3 kilograms, meaning that he's 82% of his usual body weight. And then his ideal weight is 86.4 kilograms, meaning he is 106% of his ideal body weight. I did include a weight history from May 2020, and these are from his old doctor's notes and PCP visits. So there's definitely a downtrend in his weights over the last few years. His current BMI is 25.8. He's had unintentional significant weight loss, so he's had a 10% weight loss in 2 months, and this is most likely due to the decreased intake. For his needs, we use his admit weight of 92 kilograms. So for kcals, we used a range of 25 to 30 kcals per kilogram, which would give him 2,300 to 2,760 kcals per day. For protein, we did a range of 1.2 to 1.5 grams per kilogram, which would give him a range of 110 to 138 grams of protein per day. And then for fluid, we used 25 milliliters per kilogram, which would give him 2,300 milliliters per day. I did perform a nutrition-focused physical exam because I thought I may be able to diagnose him with severe malnutrition. So for muscle loss, I looked at the temples, which were severe, the clavicle, which was severe, the shoulders, which were mild to moderate, and the interosseous muscle, which was also mild to moderate. And then for fat loss, I looked at the orbital area, which was severe, and then the triceps, which were mild to moderate. So he does have some slight edema, so he has trace edema bilaterally in both the ankles and in the feet. He's been having heartburn and loss of appetite, and then he's unsure of when his last bowel movement was. For his skin, he does have a surgical incision on his midline from the splenectomy, and then he does have a stage 2 pressure injury on his coccyx that was present on admission. For notable labs, He does have low magnesium, which was at 1.5 milligrams per deciliter, and then he also has low albumin at 2.3 grams per deciliter. So after all of this, I did place him at a high nutrition acuity. Like I said, his diet was advanced to clears following his EGD. He did report that he had not eaten anything since January 16th, making it 10 days at this time of no PO intake. He did state that the day I saw him was the first time in a while that he had been able to tolerate anything. He was able to have some broth while on his clear liquid diet, and he says that he is hungry and has an appetite, but he just physically cannot tolerate the food. To me, he reported about a 50-pound weight loss since August of this past year. He said that he used to weigh in the high 240s and now thinks he's in the high 190s. And then his admit weight was 92 kilograms, which is about 202 pounds. Like I mentioned, there was some discrepancy between what he reported to me and then what I found in his medical record and his past physician notes. So per the weight history that I found, his weight had been trending down since May of 2020. But he still had a 1% weight loss in less than a month, 10% loss in 2 months, and then overall a 14% loss in 2 years. He denies any current nausea, vomiting, constipation, or diarrhea, and also denies any chewing or swallowing problems. Again, like I said, he has not had a bowel movement during admission and can't remember when his last one was. At the time I saw him, he was not interested in any oral nutrition supplements. He let me know that he does not like any of them. I did say that his magnesium is low, but he's receiving magnesium sulfate and continue to monitor that lab and all the other labs. I also said to continue to monitor his weights closely. And then I was able to diagnose him with severe protein calorie malnutrition, and that's because of the no PO intake for 10 days, being MPO or on a clear liquid diet for another 2 days, the significant weight loss, and then the severe muscle wasting and fat loss. The diet prescription that we gave him was advanced diet as tolerated to a regular diet, and then we were able to get him to try some of the gelatine, which is the high protein jello. So we're going to add that to his trays TID while he's on a clear liquid diet. And then once his diet is advanced, we will discuss other supplement options like shake-em-ups. And then just encourage PO intake, and then nutrition will be following. So for his first nutrition problem, we said unintended weight loss related to decreased appetite, as evidenced by an intake reported to be less than usual, the need for a clear liquid diet, visual loss of fat mass and muscle mass, and then a weight loss of greater than 5%. For a second nutrition problem, we said increased protein needs related to healing and being status post-surgery, as evidenced by the presence of pressure injuries and wounds. For goals, we said improve skin integrity within 7 days, meet 75% of estimated needs from all sources of nutrient intake within 4 days, tolerate an oral diet within 2 days, tolerate the advancement of the goal diet within 3 days, and then practice weight maintenance within 7 days. Like I said, we could diagnose him with severe protein calorie malnutrition in the context of chronic illness, and that's because he met the 4 requirements. So he had less than or equal to 75% of estimated energy requirement for greater than or equal to a month, over 10% weight loss in 6 months, and then severe body fat loss and severe muscle mass loss. His BMI is still in the overweight category. And then for interventions and monitoring, we said we're going to monitor for diet and supplement tolerance, oral intake, lab results, weight, wound healing, and GI function. And then for nutrition interventions, we said encourage PO, nutrition following, and then oral intake. And then for continuing the current nutrition therapy, we said advanced diet as tolerated and monitor his weights closely. And then for the physician, we let them know why we think he should be diagnosed with severe protein calorie malnutrition, what our diet prescription is, and then if we're unable to advance his diet in the next 24 hours, we would recommend alternative nutrition such as enteral nutrition through a cord track. So that is everything. Thank you for listening.